So we're going to start with pelvic floor dysfunction. And of course, the title of the first talk is very tantalizing. Don't ask, don't tell. Anyway, our speaker, Dr. Johnny Yee, is the director of the, or associate director of the Minimally Invasive Surgery GYN program. And he has an interest in this, and we've developed a series of presentations that I think are very relevant to what some of our patients experience. So please help me welcome Dr. Yee.
All right, thank you, Dr. Cohen, Dr. Mayer. So if you ask me what my passion is, it really is pelvic floor dysfunction and trying to educate people and get women the care that they need about these things. So why I titled this as Don't Ask, Don't Tell is women will not tell you about their urinary incontinence if you don't ask them. So my focus of this talk was really to just talk about how common this is, how I look for these things in the history, and also how you can also initiate treatment with the resources that you have as well. This is focusing on the kind of primary and secondary lines of treatment and not focusing on the things that I do in terms of the tertiary lines of treatment that are available as well. But I wanted to give you some things to take home to think about in terms of talking to your patients about it and initiating treatment. So I have no financial disclosures. So these are my objectives to, again, have the tools to identify incontinence, understand the basic physical examination, have resources to share, and also initiate appropriate treatment. So sticking with audience response, what is the appropriate number of Kegels that a patient with incontinence should practice each day? Is it 10? Is it 30? Is it 100? Or is it as many as physically possible? I'll give you a few seconds here. So 30. So yeah, 30 to 100, I think that's a reasonable amount. I would say that as many as physically possible is not the right answer. And this is an email that I got to register for a course to try a new toning therapy that provides 11,000 contractions in 30 minutes. And how I talk to patients about this is that the pelvic floor muscles are just like any other muscle. You wouldn't go and do 11,000 bicep contractions in 30 minutes. And you probably wouldn't do as many as physically possible, although there are some newer exercise regimens that may encourage that, because you can have downside effects of overusing the muscle and injuring the muscles as well. So we want to make sure that they're getting the appropriate counseling in terms of what type of exercise.